Wellness for Life is brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.
Hi, my name is Ernest Hutta. I'm the director and owner of Natural Alternatives in Monaga, Minnesota. Myself, Dr. Mark Wheaton, who's a sports medicine physician, Dr. Dave Gottenberg, and Dr. Dave Anders, who are both chiropractors, all work together in a collective clinic setting in which we, the synergy of multiple practitioners working together to help with your healing and your rejuvenation. Today, we're going to specifically address one very, very common thing that chiropractors and physical therapists and people in the health world see all the time, and it's an issue called, or a syndrome called sciatica. And this is a very, very big issue to deal with because typically speaking, if you look here, you can see an overlay, and this picture shows the sciatic nerve root. It's very, very large in the buttock and through the back of the hip. So visualize on her body this major sciatic trunk going through the hip, down the back of the hamstring, and into the calf muscle. And the typical understanding of sciatica in Western medicine today is that it's created by something involving a bulged disc or an issue involving the compression of the vertebral structure in your low back. But when we look at these common terms in neurology that are called entrapment, encroachment, or impingement, we know one physiological fact, and that is that it's 6 times more likely to entrap or encroach or impinge a nerve within muscle than it is within a joint, a bone, or an articulation. So think about the articulations of your low back and the disc, and is it possible that it could be a ruptured or bulged disc that is causing sciatic pain? Well, sure, it's entirely possible, but it's going to be far more likely that it's going to be muscular than it's going to be involving structure. And so the key to understand here, sciatica creates pain that involves the entire low back and a dull radiating ache into the hip and all the way down the hamstring. Many times people come in complaining that the calf muscle is the primary source of their pain, and even down into the heel. So what I have done today is I've hooked her up here. So I've got current electrotherapy with an electroactive going through the hip. I've got one traced from here all the way down to her leg. So I'm chasing electrotherapy all the way down that entire nerve root as you saw on the overlay. And at the same time, I'm going to address 2 of the most common areas where the sciatic nerve gets compressed and irritated. So we see it in the back of the knee, in the attachment of what's called tendofascial attachment for the Achilles, and in the top of the glute. When I work these areas, many times impingements or entrapments or encroachments of the nerve involving these areas end up being alleviated and the sciatic pain goes away. And supportive care like chiropractic and physical therapy, rehabilitative exercises in conjunction with our care can be extremely helpful. Our goal, of course, is to help people avoid surgery. We would like to see that they not have to go through major surgeries for the disc or vertebral structures. That isn't to say that there aren't instances where it's necessary, because in fact that is the case. But many times, again, going back to the physiological fact of it being 6 times more likely for an entrapment to occur within muscle than it is within a bone or a joint or an articulation. So our goal is to go in and release all of these entrapment points that are very common. And you saw that from the overlay, where these are areas where the muscle structure gets so tight that it literally starts encroaching or entrapping the nerve. And keep in mind, sciatica doesn't have to be radiating from only the low back. I've seen people come in who have chronic sciatic issues that are coming from the calf, and it's actually radiating upwards into the low back. So it can go either way. There's nothing that says that it has to be coming from a disc issue. And sometimes the most profound source of irritation for practitioners is when you can't find evidence, even via an MRI or an X-ray, that demonstrates there's something seriously wrong with the low back that is creating this. And yet the person has all the same symptoms. They have the radiating pain, the aching in the butt cheek, down the hamstring, down the leg. And so again, come and check out Natural Alternatives. We offer alternatives for addressing things like this that you would not see in a typical traditional clinic. And it's not to say that there isn't help elsewhere. Our goal is to collaborate, to work together. And that's what the team of doctors that are here along with myself do in Monaga. And check out the trailer. Come and check us out for attention to this type of issue, because sciatica is one of these issues that really can compromise your life. It makes life miserable to drive a car, to walk, to do even the basic exercises in life. So come and check us out, and we'll help you out with this chronic pain issue.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and natural alternatives.